Look, I'm somewhere in between on the schools. I was critical for the length of time schools were shut down. I thought it was a good idea for a short period of time. I hear you on some of the mental health issues there. But do you think they're doing this to hurt us? I mean, again, you can disagree with them, right? And you can
I don't think they're doing it.
Right, they're not bad people. They're not evil.
They are hurting us, and eventually,
but they're wrong,
the American
according to
people
you,
need to
right?
stand up and say, "Look, it's fine for these health officials to opine and to say what they think we should do, but it always turns into the heel of the boot, forcing us to do things." And that's really where the mistakes came in.
Not a lot of this has been forced.
Process.
Not a lot of this has been forced. Most of the CDC stuff
that's wrong.
has been. It's not wrong. Most of it has been recommendations.
No. That's wrong. The fact is this you're using a euphemism, and you understand this between de facto and de jure because you're the lawyer and I'm not. But when the CDC comes out and says things like, "We strongly recommend," you know what my kids' schools would do? They would say, "Well, the CDC strongly recommends this, so that means we have to do it," because that gives grounds for somebody associated with the school to sue the school if they didn't take all the precautions. So they're playing a nice little word game here, but the CDC should stop recommending things that they don't want to see people putting into their policies, because that's what happened for years, and our kids suffered.
But
and
the
I think
CDC...
it's right for the American people to say, a woman who has been shot and boosted and taken all of her own advice still gets sick, and that's what we've learned about this virus. In the end, it spreads through the population.
Yeah, what we've learned as the virus has evolved, but again, I think they do want this to go into the policy, and it just seems to me there's a lot of armchair doctors out there.
But Matt, it has a real effect on parents like my wife and I, and that should not happen unless they're really sure that it's going to cause a harm to my child.
But it just seems to me there are too many armchair doctors out there, not just questioning the CDC recommendations, but suggesting that they're trying to do it, and I'm glad you're not suggesting this, that they're trying to do it because they don't care, or they...
No, I think they think... Look, I think they think in their crazy way of using their logic that somehow this is going to help our children. But let me just go through that. You said armchair doctors.
Yes.
You do realize in this country, it was these federal agencies that pushed policies that prevented doctors from using effective therapeutics. You had to practically get on the black market to get therapeutics like ivermectin when you're
still on the ivermectin train, really?
Well, Biden's administration just all of a sudden started greenlighting ivermectin. You know, if you were a pharmacist, you couldn't give it to a human being.
Right,
that was
because
insane,
the bottom line is, again,
Dan, that was
Matt,
insane.
I would think ivermectin would be the one you'd say, you know what, that one was a little embarrassing.
Insane. No, that was insane. Doctors have the right to practice medicine. What happened during the COVID pandemic is that individual doctors had to follow the line from the corporate entities for which they associate, and they were all following
they're all in the conspiracy. They're all in the conspiracy because they don't want to help people.
Screwed up America.
They don't want to help people. They want to make sure people die, so we won't let them have these things that are going to help them. It's nuts, Matt.
Dan, you just said, Dan, let me tell you, it's late. I'm on your show. Let me talk. The fact is, doctors were prevented from practicing medicine. My own doctor was prevented from practicing medicine, and he lost his job. A lot of doctors around this country who had a heterodox opinion to Dr. Fauci were fired from their jobs for practicing medicine. That should never happen in a free country. In a free country, a doctor who's properly credentialed should be allowed to serve his patients. In America, that was suspended.
And again, I'll just take a final rebuttal, which is to say, I don't agree that that's the way it should be. I think that if doctors are engaging in a practice that is not supported by medicine, they should be fired. But anyway, that's where we'll have to leave that one.
Why wouldn't Fauci get fired for giving all this bad advice and screwing up the country and screwing up our kids?
Yeah, I'll let you get the final word. Matt Schlapp, thank you. Thank you for watching. Go to newsnationnow.com to find NewsNation on your cable provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.